Hey, my name is Jayson Luis. I'm the acupuncturist here at Madison Medical. I just want to walk you guys through a quick case study of a patient who came in earlier today, Brazilian jiu-jitsu grappler who has been practicing for a long time. He's actually competitive. Came in today with some shoulder pain, some neck and trap issues, as well as some knee pains that kind of started recently. He's been coming into the practice for several years. I've been treating him. I kind of palpated around his shoulder. We felt some distress along the anterior aspect of his rotator cuff, along the rear also, and then around his knee, feeling toward the back of his knee where a lot of popliteal fossa is where a lot of where the knee bends, that back region, a lot of inflammation tends to develop. So whenever I'm treating any of my athletes or regular gym goers, I like to focus on trigger point acupuncture, so also known as mortar point acupuncture. So basically there are trigger points all over the body. A trigger point is basically where an area in the muscle, also known as the belly muscle, where a lot of the innervation occurs, a lot of the muscles recruit. The area is susceptible to distress, tightness, pain, and discomfort. So you can see there are a lot of trigger points. All these X are kind of marking where the trigger points are commonly found. Of course, you know, with palpation, different areas, different people might be somewhat different, but when you palpate, you can feel it. Sometimes a little bit of resistance, sometimes some pain. So of course, when we go in there with an acupuncture needle, and what happens when we hit a trigger point with an acupuncture needle, you kind of see the muscle kind of fasciculate. You see the jump, the muscle kind of jumps, like a strong contraction, sometimes mild, sometimes huge, sometimes obvious, right? And what happens when that muscle kind of contracts like that, it's kind of like a reset. So you get the needle into that muscle, the muscle jumps, and as it kind of settles back into place, if there was any kind of displacement or tension or kind of distress within that muscle, as it settles back from that contraction, it goes back to where it should be. So any kind of distress, tightness, like restriction, afterwards, once we get that reset, it should feel a lot more lucid, range of motion should be increased, and of course some pain relief, blood flow should return, and inflammation should be able to kind of like get out of the area, and fresh blood should be able to flush right back into that area. Aside from that, I like to do infrared heat therapy. Of course, right now, infrared heat has a whole wave in social media. You guys see it all the time. Infrared heat is really good for creating agitation within the cells. Imagine like a pot of boiling water. All that movement kind of cooks off excess fluid, so really good for bringing down some inflammation. Cupping is a great modality for athletes and just anyone with pain and tension in general. So with massage, which all of us know with massages, that pressing in is considered positive pressure. Cupping is the exact opposite. It's negative pressure. It's pulling up and out. So if you're dispersing with a massage, kind of pressing in to disperse fluids and move things around, with cupping, you're pulling up. So any residual inflammation or deep-seated inflammation in the muscle layer, you can bring that up to the surface, create more space in the underlying tissues for things to flow, get that inflammation up, and just go back into circulation, basically. And then I also love coupling that with red light therapy. Right now, I mean, there's so much studies showing the benefits of red light therapy. Helps increase ATP production within the cell. So ATP basically drives any process within our body to take place. So basically you're creating more fuel for whatever process you want to occur. So just to wrap up, talking about the case study I was describing earlier, patient by the end of the session, a little bit of acupuncture with some stem, some cupping, some red light therapy, and of course some infrared heat. And then we followed that up with some hands-on body work, some Chinese tuina. So we got into some of those trigger points manually and kind of massaged them and got some myofascial release. By the end of it, he usually is pretty satisfied, and I think today was no exception. So for anyone else out there who wants to either perform at a higher level, get some pain relief, or just be exposed to this world of acupuncture and Chinese medicine, it would be a pleasure for me to meet you and guide you along that process, and feel free to contact the office, and I look forward to seeing you then.